Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nina Valens, and we're taking your calls at 866-870-5752 right here in the studio. And if you call right now, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And again, that number is 866-870-5752 right here in the studio, and you can speak directly with Dr. Darrow. Right now we're speaking with Anna.
Anna, Dr. Marc Darrow, how are you again?
Hi.
Thanks.
Thank you.
Thank you for sticking with us. So I'm going to give a quick history here for the second half of the show, just so bear with me a little bit, Anna. The work that I do as a medical doctor, and I've done my entire career since my residency at UCLA, where I learned about it, is called regenerative medicine. And at the present time, we're using PRP, which is platelet-rich plasma, and it's a very simple procedure of drawing your blood and spinning it in a centrifuge and getting rid of the red cells. The red blood cells are very caustic to the knee, and they will upset the synovial tissue and create what's called an effusion or fluid in the knee of excess hyaluronic acid, which is what these injections are that doctors give all the time as a lubricant, which is really, in my opinion, not very worthy of anything. It's very expensive. And the best way to get that hyaluronic acid, if your knee is, let's say, dry, which most knees are not, is to do PRP, but not with the red cells. The other way of doing regenerative medicine today that's amazing is to actually take bone marrow. And I can do it as quick as or faster than most people can take blood. I numb up the back of the pelvis and put a needle into the bone a little bit and aspirate it, just draw it out. That usually takes me, once it's numb, about 15 seconds to do the whole procedure. So bone marrow not only has the platelets, like the blood does. By the way, the blood doesn't have the stem cells we need, but the bone marrow has the platelets and it has stem cells and exosomes and cytokines and other great healing factors. So it's the best treatment that we know about today. If something else later this afternoon shows up, I'll be one of the first people to learn about it and start doing it. But right now, the bone marrow with stem cells and platelets is a great treatment. And you were talking about your knee being painful and having some arthritis in it, osteoarthritis, but you're still active, so, it hurts when you walk a bunch, but you can bend it and you can walk. So I'm going to just say it like this. Your knee is not very bad. I get people in that can't walk, that can't do anything, and oftentimes we can get them better. So I think you're a great candidate just talking to you. I have to examine you first to know what's going on. Look inside with an ultrasound. Not the kind of ultrasound that heats things up, but the kind that's like a camera that looks in the body. Like when a woman wants to take a look at her uterus or see if there's an ovarian cyst or something like that, we use an ultrasound. Same thing with the musculoskeletal system. We use an ultrasound and we can look inside the joints or at the ligaments, see if there's tears and see if there's fluid in there or whatnot. So I'm going to bet that you're going to be a fairly easy heal, okay? But I can't promise you anything. Now, did you have any other questions about your knee or about procedures or what we do? You can look on the website at www.lastemcells.com, and you can watch me do injections under ultrasound of a knee or shoulder, hip, what other areas of the body, necks and backs. I inject basically the whole body. I've been doing this longer than anybody I know, and I do the most of anybody that I've heard of on the planet. I do this all day, every day long, and it's what I love. It's worked on me all over. I've done my knees, my shoulders, my elbows, my wrist. I've had other people do my neck and back because I can't reach back there.
Yeah, you're going to reach, right?
What's that? I didn't hear you.
You're going to reach, yeah. You're going to reach your back, yeah.
No, I can't. I have a friend who actually injected his own neck in a mirror.
Maybe look in the mirror.
Yeah, but I'm not going to do that. Everything's backwards doing it that way. It's not something I want to do to myself.
So I will call, do you think, should I call Monday morning to make an appointment?
You can actually call right now. There's people by the phones at 800-300-9300, 800-300-9300. And you can call now and get more information that I didn't talk about, more details. And I'd love to see you. And it sounds good, Anna. I mean, I know you're in pain, but like I always tell people, pain's not a reason to have surgery. Right. Yeah, I try to avoid it. I went to the orthopedic and he scheduled surgery for me for the 2 months. I said, no way, so. Yeah. Well, there's no reason to do surgery, which is very invasive and has all kinds of terrible side effects, when you can do something like getting an injection. It's a recovery. I've been reading, and it's terrible. The recovery is terrible. So, I want to avoid that complete. So my husband was listening to you, and he said, call this doctor. I said, okay, good. I called right away. Good. Okay. Well, you sound good. It sounds like your knee is not too bad, and it sounds like we can help you. But again, I have to examine you. You're not a patient yet. And and I bring whatever. I have a this, and I have a report, right? I bring it with me. So just bring me some Hungarian goulash. It's my favorite. It's my favorite food group. Okay. Sounds good. Yeah. Okay. Thank you very much. Nice talking. All right. God bless you. It's good talking to you, Anna.
Thank you very much.
Thank
you, Anna.
Thank you. Bye-bye.
Okay, you're listening to Living Pain-Free with Dr. Marc Darrow, and you get a free book if you call us right now, 866-870-5752, right here in the studio. That's 866-870-5752. Do you have anything else going on at the office right now you want to mention? Sure. We do the vampire facelift. Don't forget that one. No one will forget that name, right? Right. It's very simple. It's actually taking the same cells that I use to regenerate collagen and cartilage in the musculoskeletal system to put into the face to rejuvenate the face and make people look younger. Works very simply, very easily. Also, we regenerate hair on the head by injecting the same cells. And in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, there's chapters in the back about vampire facelift and about hair regeneration. So it's something that men and women like to do, believe it or not. And it's not just a vanity thing. It's more like a youthful thing. And it's the same thing with what I do with the musculoskeletal system, with your joints, tendons, and ligaments to regrow the tissue, arthritis and whatever. It helps people stay young. It's all about staying young. I know it's a mental thing also, but it's nice when the body conforms to what the mind wants it to do. And I'm 73. I'm still doing sports like crazy. This afternoon I'm going to probably go for a run in the mountains. And I can promise you this. I've had meniscal tears in my knees. I didn't do surgery. I injected myself and got them better. I was limping around for a while. I was thinking, gee, I might need surgery. Never. No. Right. But, you get that scare. You go negative sometimes. And I fixed my own knees, injecting myself with platelets and stem cells, and I'm doing great. Well, remember the byline of the show. We take the surgery out of pain. Yes. So I'm going to take a question here. Let me find a question. Okay. I'll give the phone number right now. You get a free book if you call right now. 866-870-5752, right here at the station at 866-870-5752. But actually, you know what? I want to ask you a question, Nita, and you have to just answer right then. You can't think. All right, no thinking. No. What do cows most like to read? Grass.
That's a
Tea
good
leaves?
answer.
I don't know.
Cattle logs.
Oh, that's a good one.
Okay, what do you call a sleeping dinosaur?
I have no idea.
A dinosaur.
Oh, that one's good. That one's
Can I
good.
do one more before you kick
All
me
right.
off the show?
Yeah, I won't kick you off. I'll
What
just
has-
cry, but go ahead.
What has 4 wheels and flies?
A new car?
Close, a garbage truck.
Okay, I think we should go talk to Patty in Thousand Oaks.
Patty, how you
Patty.
doing today? Dr. Marc Darrow.
I didn't get hit by a garbage truck.
I hope not. Patty, I understand that your shoulder and your finger hurt. So let's talk about your
Right.
shoulder first. How long has that bothered you?
I actually got injured in an accident where somebody had an open drain in a ladies' room, and my heel went in it, and it just
Oh, my
snapped
God.
my body.
Yeah.
It's horrifying. And I'm very I was very healthy. I'm 76,
Okay.
and I have taken the time, and I have a good chiropractor.
Good.
And from not being able to walk or anything like that, I'm back up and running, except for it settled in when I first got the injury, I couldn't even move to either side. You know, I had anyone near me for 6 months. So it's all now subsided except for my shoulder, and then it goes down my right arm, and it wound up where my index finger and thumb are numb.
Okay.
The middle finger is almost numb. I mean, I can still get use out of it.
Okay.
But so I'm. It all sounds good to me. I'd like to get back to where I was.
Let me give you some information, okay?
Please.
Your index finger, thumb, and part of your middle finger, I guess it is also, you said,
Yeah,
are
it's
part
here.
of what's
I mean,
called the
it's not-
C5-6 nervous distribution or nerve distribution, okay? And
C5
that
and 6.
C5-6. It also could be what's called carpal tunnel syndrome. It's probably one or the other. The way you find out is by getting a nerve conduction study and an EMG. If you came into the office, if you want to do that, just call 800-300-9300. You can come to the office. I'll order that for you, and we can ferret out where this numbness is coming from. There's some nerve impingement, okay? And
Okay.
It can come from the wrist, you know, from your fall, or it can come from the neck from your fall. And the other issue, once we find that out, we can help you. The other issue about your shoulder,
Okay.
yeah, the other issue about your shoulder is something different, okay? That's it seems like it might be the same because the pain seems to radiate or the numbness radiating from the shoulder, but that's probably a different issue. Can you move your arm up in the air all the way?
Now, yes, I can.
Good.
Not completely.
Not
I
completely,
mean, it'll go
okay.
straight up, but
It hurts a little bit at
not
the end.
for a minute. Huh?
Yeah.
You know.
So
it's
we
just
would
like-
probably work on your shoulder with platelets and or stem cells and get that healed up. Sometimes that'll heal the issues down the arm. Okay, a lot of that is referral pain from the shoulder. But also it may be, like I said, the C5-6 distribution, which may be an impingement in the neck or the wrist, possibly the elbow. Okay? A lot of possibilities.
Okay.
We'll get you the EMG and nerve conduction study, which will zero in on where that is coming from.
Okay. Just
Sound
call
good?
the office.
Yeah, call
Yeah,
800.
are you kidding?
Call
Sounds great to me.
800-300-9300. That's 800-300-9300. Because you called in, I'm going to give you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got a couple hundred pages, 256 studies about why you do not want to do surgery in most cases and why you do want to do regenerative medicine, which is just growing back tissue and healing that way.
Okay. And while I'm there, maybe I'll look at what was it? The monster faceless vampire.
Oh, yeah, well, that would be a good name, the monster. No, it's the vampire, because we use platelets from the blood or stem cells. So it's red stuff we put into the face to make the tissue grow back and make you look younger. So thank you so much for calling, Patty.
I appreciate it, sir.
And
thank you.
go to the
Have a good
website.
day.
You can
I'll
watch
be
me
calling.
doing these procedures. It's www.lastemcells.com. You can email me from there or just watch the videos and learn. And I want to go to Robert before he wants to get bored listening. Robert, I understand that you've got stenosis in your spine and you may need surgery. So tell me about it. Do you have neck pain or back pain?
Okay, I have a grade 2 stenosis of L4, L5. I also have a bulging disc. I went to a neurologist, went to several doctors, and they all say, "Oh yeah, you need an operation."
Okay.
And they want to do a fusion.
Okay.
And I'm just scared to death of that. I've been listening to you for a while.
I don't blame you. Yeah, I don't blame you for being afraid of that one. That's a big deal.
So, seeing you, is that going to help?
I have to ask you some questions first, okay?
Sure.
Do you have neck or back pain?
I have back pain and leg pain. It's probably it's all the time. It's maybe a level 3
Okay.
as far as the pain level.
Okay, so your back pain is a level 3 out of 10?
On a 1 to 10, level 3, or 1 to 5?
Yeah, on the 1 to 10. Yeah.
Okay.
Okay, so your back pain's not too bad, but it still bothers you. And how about the leg pain?
Okay, the leg pain it's about a 4, and
Okay.
I mean it definitely hinders my activities.
Okay.
I can sit okay, but it's standing that really bothers me.
Okay.
Standing or walking.
Okay. So I may be able to help you with your back pain, and sometimes that helps with the leg pain, and sometimes it doesn't. Okay? Because if you truly do have stenosis that's causing the issue, then you might need a surgery to resolve that. The back pain generally does not come from spinal stenosis, though. You could have two things. You could have a problem in the back that I can fix, and you may have stenosis causing the leg pain, or it may just be no stenosis at all that's causing the problem, even though on an X-ray or MRI it shows stenosis. There's tons of people that have stenosis in their neck or spine, but don't have any pain at all. Don't get confused because you have stenosis. Does that make sense to you, or is it confusing?
Yeah, I understand.
Okay. And you may need also, I mentioned to Patty, I think it was, that she may need to get an EMG and nerve conduction study to find out what's really going on. Because MRIs and X-rays are big liars. I like to get them because I found a couple cancers by getting them, but I don't rely on them to treat. Surgeons rely on them to treat, and then often the surgery goes bad because it wasn't the problem. So I would have to examine you, like I tell everybody. I get emails every day from all over the world. People say, I'm going to send you my MRI and then tell me if you can help me. That doesn't help me. It doesn't help me tell me if I can help you. I have to examine you. So, if you want to come in, the number to the office is 800-300-9300. It'll take me about 2 minutes to figure out what's going on, and then we can go from there and tell you what to do. Have you had an epidural?
Robert, are you there?
Yeah, I'm here. The connection is bad. I can hardly hear you, but I'm making the best out of it.
Okay. Well, why don't you take off your Bluetooth or whatever it is and see if you can hear us better. Robert, can you hear me? Have you had an epidural in your back?
Yeah, I had one, but I know that they're not good, so I only had one. They needed to do it for some reason to find out which nerve was causing the problem.
Did
And
the
it didn't do nothing, by the way.
It didn't do anything. That's good news. That means it's probably not spinal stenosis. Okay?
Okay, got it.
You can have just low back pain. You can have ligaments that refer down the leg. You can have the facet joints that refer down the leg. There's a lot of issues that I don't know about with you until I touch your body to figure it out. So, like I say, if you want to come in about 2 minutes, I can probably tell you what's going on and what your next step would be, whether regenerative medicine can fix you or not, and whether surgery is a good option for you. But I certainly wouldn't jump into a surgery based on what you've told me, because it may be a big, big, big surgery that comes out really bad, and you didn't need it to begin with.
Okay, well, I'll give you a call then. I'll get all my MRIs and X-rays together, and we can make a decision.
All right, man.
Thanks for your call, Robert.
You know what my MRI is, Robert? My fingers.
Yeah, I like that.
I don't honestly. I'm going to be honest with you. I don't really care what your MRI says. I don't treat based on MRIs. And again, people come in the office who have heard the radio and they go, "I'm not getting an MRI because you said they're no good." I didn't say that. They are good, but they're not the reason for pain necessarily. But they do give us information that we want.
Well, MRI, I'm going to tell you something about MRI. Like an idiot, I got surgery on my knee about 10 years ago.
Yeah.
And it was the better of the two knees. Now it's the worst. They just did an orthoscopic surgery.
Yeah.
If I would have known that they were going to take 75% of the cartilage off, I never would have got it.
Yeah. You know, here's the thing. This is advice for everybody listening. If you do decide to get a surgery, have the surgeon put in writing and sign it exactly what he's going to do. I've heard your story, Robert, over hundreds of times. I had a very close friend who had an ACL rupture. He went in to put in a graft, and he came out without anything in his knee. And then they told him he needed a knee replacement right afterwards. So, look, it's not the surgeon's fault. I love surgeons. They do the hardest work in medicine. It's the culture. The culture is clean it out. And I'm not for that. I'm for rebuilding the tissue. And regenerative medicine using platelets and stem cells does that. So anyway, that's my own little opinion. I'm one guy. I've been doing this a long, long, long time. I've been told I do the most of anybody on the planet. And I've had a very successful life and career doing this. And none of the orthos like me because of it. You know, I'm the devil to them, but they're the devil to me. You know, that's just different cultures. It's like different religions. So I'm sorry about your knee coming out like that, but there's good hope for your knee to heal up too using, you know, platelets and stem cells.
Oh, good. Maybe I'll look into that too.
All right, man.
Now is my back.
Robert, God bless you.
Robert.
There's good hope ahead for you. Okay?
If you call us right now, you get a free book, 866-870-5752. Oh, I guess not. Okay, we are out of time. Thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. Grab a pen or a pencil. Write down this important information coming your way. Listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. Thanks for listening. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.